Morning, everybody. Welcome to the 2021 National Healthy Homes Month webinar series. National Healthy Homes Month offers an opportunity to learn more about housing and its impact on health and provide resources to encourage local activities as well as empower families to protect themselves from hazards in their home. These webinars support the 2021 National Healthy Homes Month theme of the power of partnerships. Our theme highlights the vital role that partnerships play for implementing healthy homes concepts in communities nationwide. Whether called collaborations, coalitions, project teams, task force partnership, or short or long term, these efforts are instrumental in education and prevention. The diversity of presentations and topics in our program shows how pathways can be developed according to community and housing needs. For more information about National Healthy Homes Month, including resources for your program, you can visit www.hud.gov/healthyhomes. Today's webinar is Natural Allies, Partnering to Improve Health and the Environment Through Housing. Our presenters today are Amanda Reddy, Executive Director, National Center for Healthy Housing, Tom Neltner, Chemicals Policy Director for the Environmental Defense Fund, Dan Chu, Executive Director, Sierra Club Foundation, and Surili Patel, Vice President of the Metropolitan Group. We are pleased that you have joined us for this event. This webinar series is sponsored by the HUD Office of Lead Hazard Control and Healthy Homes, USDA National Institute of Food and Agriculture, and the National Healthy Homes Partnership. This webinar will last approximately 90 minutes, including 15 minutes at the end for questions. At the end of the webinar, you'll be given information on links to additional resources for your program. We are recording this webinar and posting it for you for your later viewing if you prefer. Because of the large number of attendees today, we have to keep everyone's mic muted. However, if you have questions, please feel free to post them in the questions window and we will read them to the presenters. I will now turn it over to Kit Rodkey of the HUD Office of Lead Hazard Control and Healthy Homes for his opening remarks.
Thank you, Michael. I'm Kit Rodkey, the Senior Outreach Specialist for HUD's Office of Lead Hazard Control and Healthy Homes. On behalf of HUD, we welcome everybody today to this kickoff of National Healthy Homes Month. As Michael mentioned, each June we coordinate this national outreach campaign to increase awareness and preventive actions around various indoor environmental health hazards and other issues. Here, we selected the power of partnerships as our theme. During the pandemic, we think that these relationships have been perhaps more important than ever in implementing these healthy homes concepts. Our first webinar, as Michael's already mentioned, is with the National Center for Healthy Housing. It's a collaboration we've had for many years. NCHH has been integral to amplifying our healthy homes messaging, has conducted training, joined us in our healthy homes conferences over the years, among other activities. So without further ado, Michael, back to you.
Thank you, Kit, for those opening remarks. Our first speaker is Amanda Reddy, the Executive Director of the National Center for Healthy Housing, an organization founded on the premise that better housing can be a powerful platform for better health. Prior to NCHH, Ms. Reddy was a research scientist with the New York State Department of Health, where she provided program evaluation, management, and technical support for its asthma, healthy homes, and lead poisoning primary prevention programs. Ms. Reddy holds an MS in environmental health from the London School of Hygiene and Tropical Medicine. And so, Amanda, I'm going to switch it over to you and make sure your mic is okay. So let's switch over to you. You are good to go.
Great, and good morning, everyone, and happy Healthy Homes Month. As Michael mentioned, I'm Amanda Reddy, Executive Director of the National Center for Healthy Housing, and it is my absolute pleasure to partner with HUD to kick off this month's Healthy Homes celebration with this important conversation. For those who aren't familiar with the National Center for Healthy Housing, or NCHH, we are a national nonprofit and were originally founded close to 30 years ago to tackle the issue of childhood lead poisoning. Over the years, our mission has expanded to address a much wider range of residential hazards and to consider the impact of the housing environment across the lifespan, and that continues to evolve, as we'll hear during today's conversation. The way that NCHH addresses the issue of housing quality is through a combination of research that helps us to understand both the problems we face and the solutions available to us, through advocacy and awareness building at the federal, state, and local levels, and through community capacity building. So although, unlike many of you, we're not the ones out there on the front lines identifying and fixing hazards in homes, we are here to make sure that those of you who are on the front lines have the best tools, data, and evidence-based policy and practices that you need to get the job done. And a big part of the way that we get that work done, and we know that you do too, is through partnerships, which is why this year's theme for National Healthy Homes Month, the power of partnerships, resonated so deeply with us. But also because many of us have limited resources and time, and building meaningful partnerships can take a lot of both of those things, it's also a great opportunity to examine those partnerships and figure out how we can partner even more strategically to advance the critically important work of ensuring that everyone has a safe and healthy place to call home, whether you think of home as the place you sleep each night or the planet we live on. So today is really about deepening the conversation around some potential allies and examining why housing is often left out of conversations about improving the environment, despite a lot of common priorities and a lot of overlap in our agendas. Understanding why that happens, talking about what we can do about it, and why it really matters for healthy housing. But before we dive in, we'd like to understand a little bit more about who is here for today's conversation. So Michael, if you could bring up our first poll question here.
There it is.
Great. For this first question, we want to know about the primary focus of your organization or work. And please note that you are not limited to just one answer choice here. And we know that there probably are many other answer choices that could describe your organization. We're limited by our technology to give you 5 choices here. You should also be able to note that you should be able to choose all that apply. So if your organization works on both healthy housing and energy efficiency, you should select both options as your answer. So we'll just give everybody a few more seconds here to contemplate your choices and log your answers. And selecting all that apply to you. And Michael, if it looks good to you, why don't you go ahead and close the poll there?
It looks like a few more people are voting, so give me a few more seconds and I think we'll be ready to go. Okay, so we're going to close it and then I'm going to share the results.
Great. So it looks like we have folks who are representing lots of different organizations. Certainly a lot of you representing healthy housing and affordable housing, the built environment, which is not surprising given our hosts here at HUD, but also folks representing the natural environment, public health and environmental health, environmental justice, as well as some folks from the energy sector. That's great. That's a great representation of who needs to be in this conversation. And to follow up on that question, we have one more for you today. So Michael, if you can bring up the second poll question, please. For this question, we'd like you to look at the list of issues or topics on your screen and tell us which of these issues are important to your organization's mission or to your work. And again, we know that there are many other issues that are important that aren't on this list. We are limited, again, to just 5 choices because of the technology. But of the issues that are on this list, can you just tell us which ones are important to you? And like the previous question, you can pick more than one response here. So you can select as many as you want.
Looks like about half the people are voting, so I'll give it a few more seconds here. And
Michael, when it's ready, you can go ahead and close that out, share the results with us here. Okay, and we're seeing, across the spectrum, whether we're talking about, clean water, clean air, climate change, emergency preparedness, chemical safety, those health and well-being endpoints, that all of these issues are important to folks in our audience today. So that's great, Michael. You can go ahead and close that out. So I come from the field of environmental health and see healthy housing as a subset of that field of how our environment impacts our health and well-being. And if we were to map out the distinction between environmental health organizations like, for instance, the National Environmental Health Association or the American Public Health Association, which has a robust environmental health portfolio, and more traditional environmental organizations that focus on the natural environment, organizations like the Sierra Club or Nature Conservancy, Environmental Defense Fund, and others. It might look something like this if we were just to map it out conceptually, right? They both have their distinct priorities and agenda, but there also is a healthy overlap here. After all, we just saw that reflected in our answer choices. We have a mix of those organizations on the line today, but also, that a strong interest across the spectrum in clean water and clean air, climate change, chemical safety, health equity, and more. So it looks clear that there's ample room for collaboration, synergy, amplification of each other's messages and priorities. But those of us who work in this space, especially in the environmental health space, often talk about how in reality it looks more like this, right? That despite the common agendas, that the environmental organizations that focus more on those natural spaces, wildlife, seem to have, more power, more resources, more funding, more awareness. For instance, I don't have any hard data, but I'd be willing to bet that more Americans have heard of or donated to or retweeted organizations like the Sierra Club and Nature Conservancy than have done the same for the American Public Health Association or National Environmental Health Association. And these environmental organizations also tend to be funded on a much bigger scale. They garner more headlines and popular awareness, and that translates into really important decision making. For example, in the current administration's proposal to invest heavily in infrastructure, environmental health, which includes, again, healthy housing, is not named as an overarching frame or theme for that proposal. But climate change, as these environmental groups see and define it, definitely is a strong organizing theme for that proposed package. And of course, though, there is, despite this imbalance, there is still overlap, and we do have some wonderful examples of where the collaboration has worked or is still working. For example, my own organization has spent years, as have others, documenting the co-benefits of energy efficiency, green building, weatherization, with health and healthy housing endpoints, and really learning more about how it can be done effectively to advance goals related to all of these things, to energy, health, and housing. And you've seen on your screen in the last two slides some links to specific resources about that evidence base. And many of you around the country have translated this evidence base into action with partnerships that coordinate resources related to energy, health, and safety, particularly in low-income communities. There are too many to list here, but you see on your screen an example from Washington State, where the legislature established an initiative to allow weatherization programs to also invest in improvements and home repairs that help children and adults with asthma, so that those families can see reductions in their energy bills and improvements in their asthma, all while reducing their energy footprint. This initiative started as a pilot project back in 2016 and continues to grow with a goal stated on their website of making it available across the entire state this year in 2021. And I see in the attendee list here many others on the line who also have inspiring stories. For example, our colleagues from Isles in New Jersey, who have been doing some really innovative work with traditional environmental groups. And I'm going to encourage Isles and others on the line to start sharing your stories in the chat about where this type of collaboration has worked or is working. And you can see, in addition to those stories being shared, you can see more examples on the link shared on your screen here. Many of us have also been increasing our work on the ground and at the national level to respond to the needs of communities in the face of a changing climate, before, during, and after events like wildfires, floods, hurricanes, extreme heat, or extreme cold events like we've seen this past year, and are forging new partnerships in the process. I'll also mention the work of groups like the Lead Service Line Replacement Collaborative and the National Environmental Health Partnership Council, which I currently co-chair, as an example of existing collaborations that can be leveraged to advance more cross-sector efforts. And apologies, it looks like I'm missing a slide there, but I will share those links in the chat during the discussion today so that you can have links to those groups. So we have a strong foundation and a history of success and collaboration to build on, but this imbalance still exists. And we definitely aren't fully exploring or leveraging our potential for collaboration with big environmental groups. Environmental health and housing in particular just don't get a seat at the table that often. So today's conversation is really about exploring more to learn how we can work together to amplify and accelerate our common goals, to learn what is standing in the way and how we can get from here to here. So before I turn it over to the panel, who's going to help us with that conversation, let's take a minute to explore just a few of those reasons that those disconnects might exist. First, conventional wisdom tells us that environmental and healthy housing groups, environmental health, and healthy housing groups are often focused on people and human health, while the big environmental organizations care about wildlife and natural spaces. And if you're a busy, healthy housing practitioner with limited resources and time, it may not seem strategic to reach out and partner across what feels like a big divide. But of course, these things are interdependent. And the reality is that if you go to websites of the organizations of these environmental groups, and I'm going to pick on our panelists here and call out the Sierra Club and the Environmental Defense Fund, you'll see a lot that resonates. So for instance, on the Sierra Club's website, we see a lot of headlines featuring people and calling out that racial justice is environmental justice, right? This is a conversation many of us in the healthy housing field have been having in our own organizations. You'll see here images, right? Everyone deserves clean drinking water, with an image that many of us in the healthy housing field could see in our own materials that we provide to the families and communities we serve. And look at the language here on this page, protecting our home. That the language of home is built right into this narrative here. Turning to EDF's website, if you look at their key priorities, we see people and communities and all of these images here. If you talk about the issues they address and the approach that they take, health is highlighted as a central facet of that. And they also carry really familiar messages about key healthy housing issues like lead. So although that has been a source of disconnect, I think that's a changing picture. Another reason for potential disconnects is around the language we use. So sometimes, because of the different endpoints that we have in mind, we use different language to talk about the same or overlapping activities. So as an example here, you'll hear environmental groups talk about electrification as a way to reducing emissions. And at the same time, you'll hear healthy housing practitioners talk about replacing gas stoves with electric in homes to reduce exposure to particulate matter, nitrogen oxides, carbon monoxide, and other contaminants in the indoor air, perhaps just missing an opportunity where a common solution advances two agendas. Other times, however, we are using the same language, right? For instance, an interest in clean water to signal interest in slightly different priorities, with environmental groups often expressing concern about surface water and the impact on wildlife or recreational opportunities when they're talking about clean water, where environmental health and healthy housing groups may be more concerned about safe drinking water, whether that comes from surface water or groundwater, and really maybe focusing even more on the infrastructure that brings that water to our homes. And you'll see here I've updated the CDC graphic to include housing as part of the picture here in terms of the impact and endpoint of safe drinking water. There are also sometimes different regulatory mechanisms. So if we think about air quality, for instance, outdoor air is regulated in ways that indoor air quality isn't. In stark contrast to specific outdoor air standards, indoor air quality isn't regulated at the federal level and is more often regulated through indirect pathways at the local level. So for instance, housing codes that require conditions that would reduce exposure to certain contaminants rather than regulating the contaminants in indoor air directly. But with outdoor air, we know that these things are related and that what's outside gets inside, what's inside often builds up. And the EPA has said that studies of human exposure to air pollutants indicate that indoor levels of pollutants that we commonly monitor and regulate outdoors may be 2 to 5 times higher and occasionally much more than that, higher inside than compared to outdoor levels. And finally, audiences can pose potential barriers to collaboration too, although they may also be part of the solution. So for instance, in some cases, we're just speaking to different audiences who demand different narratives. When you think about climate change and the way you speak about climate change to your stakeholders in your professional life, do images like this come to mind, right? I think that's true for many of us in the healthy housing world. Or do images like this come to mind, which may be more true for folks who represent those environmental groups and those of you who are on the line representing that sector. those different frames can sometimes lead us to pursue different solutions and not see the potential for overlap and collaboration. And of course, even when the audiences are the same, it can sometimes create a sense of competition for resources. But it doesn't have to. And I think we have reason for hope, because I think it is becoming clearer and clearer that whether we're talking about clean air, clean water, climate change, chemical safety, emergency preparedness, racial justice, that housing must be a central part of the conversation and the solution, right? So that's bear saying again, that housing has to be a central part of both the conversation and the solution. And I think that, we in the healthy housing field are not the only ones noticing these connections. For instance, the Sierra Club's Build Back Better agenda specifically calls out substandard housing and the intersection with environmental justice, racism, income inequality, climate pollution, energy burden, and health, right? So pulling out all of those connections that many of us talk about in our work every day. And it ends with this powerful statement: the crises we face are interlocking, and thus our solutions must be as well. So our charge for today, as you listen to the next three panelists, is to help answer that call, that powerful call. If you're a practitioner at the local level, providing direct services, going into homes, I invite you to listen for opportunities for new partnerships. Look for common interests or new ways that you can talk about your work. So for instance, if that word electrification is new to you today, then listen, right? Listen as we hear Dan Chu and others speak about it, and look for ways that it might intersect with things that you already care about. If you're already doing this work, or as you get started, another thing that we can do is share your stories so that others can get inspired and see those connections too. And you can get started by sharing them in the chat today. Hopefully some of that's happening already. If you're an organization like mine that focuses on research or advocacy, then I would say our job today is to first take those stories that we're hearing and amplify them, right? To help create new policies and funding streams that make those types of collaborations easier and more possible. And also to make sure that those folks on the front lines have all of the information that they need to help them make the case and to do their work. So let's be listening for opportunities to partner around that. And if you're a funder on the line today, I hope we have some of those. I encourage you to look for opportunities to model these types of partnerships, to reach out to other funders to co-invest, to encourage, require, or incentivize your grantees to collaborate across these lines, and also to pay for and reward the time it takes to invest in meaningful partnerships. You also have an important role to help create those connections and open the door for collaboration. And I would argue that the work that we do, those interlocking crises that we're trying to solve, deserve nothing less. So without further ado, I will turn it over to Michael, who will introduce our next panelist, Dan.
Thank you, Amanda. That was a fantastic introduction, not only to this topic, but actually to National Healthy Homes Month. So thank you for that. Our next presenter is Dan Chu. Let me make him the presenter so he can bring up his slides. Dan, go ahead and accept the pop-up. There you go. Dan Chu is the executive director of the Sierra Club Foundation. Previously, he was the national director of the Sierra Club's Our Wild America campaign, which protects land, waters, and wildlife, keeps dirty fuels in the ground, and connects people with nature. Dan's environmental career began in the 1980s as a canvasser. He later served as the Wyoming Wildlife Federation's executive director and as the national vice president for regional programs at the National Wildlife Federation. Dan holds a Master of Science from the University of Colorado. So Dan, we are ready for you.
Great, thanks for this opportunity today and welcome. Thanks again to Amanda for inviting me for this and for the kind words that she just talked about as it relates to the Sierra Club and our evolution, I guess you could say, to be much more intersectional in our approach between protecting the environment, but also ensuring that social justice is advanced in everything that we do. So I'm Dan Chu, I'm the executive director for the Sierra Club Foundation. The Sierra Club Foundation serves as a fiscal sponsor for all the charitable work of the Sierra Club. And we also manage and steward investments and assets on behalf of the Sierra Club in ways that also advance the mission. So today I've been asked to talk a little bit about how the Sierra Club is thinking about protecting the environment in a way that intersects with affordable and healthy housing. So for those that have heard of the Sierra Club, just a quick overview. The Sierra Club is a national organization, primarily domestic focused. We have 64 chapters in every state and territories, including Puerto Rico, as well as about 400 groups. So within each state chapter, there are local groups as well, and 4 million members and supporters across the country. The Sierra Club is very much a democratic, bottom-up governed organization, and we look to community leaders and our chapters to really inform the kind of work that we do and hopefully deepen the partnerships that we can leverage to create a more safe and just planet. The Sierra Club over the last 5 or 6 years has really dug in deep in a transformational change to truly center equity and justice in all of its work. Traditionally, the Sierra Club is focused on addressing the climate crisis, protecting land, water, and wildlife, and ensuring that people get outdoors and enjoy nature. We now really think of that in ways that also have the for all next to those 3 elements. How are we protecting the planet in a way that creates greater justice for all of the inhabitants of this planet? So as we think about that, I just wanted to quickly review, and some of you have seen this slide before, 3 terminologies that we think of at the Sierra Club. So equality really is the premise that everybody gets the same benefits and the same supports, and thus equal treatment. Over the last few years, we really leaned in and thought hard about how is our work in a way that is equitable. And what that means is that we recognize that people have different starting places in our society, and some folks need additional support and additional help to be able to have more of a fair and equitable life. But ultimately, where the greatest benefit can be and the greatest impact can be is to really think deeply about what are those systemic inequities and systemic challenges within our society that is creating injustice, and to really think about how do we tackle those systemic barriers, remove those barriers, and truly create justice for all. So what that means is that we think of all of our work now, be it addressing the climate crisis or protecting land, water, and wildlife, in an intersectional way and in an intersectional approach. What that means is, how are we approaching something like reducing carbon emissions in a way that also creates more quality jobs, better living standards, a greater affordability for people all across the socioeconomic spectrum? How are we measuring our success? Not just in carbon that's reduced, but also in asthma rates that are reduced, in quality jobs that are created, those kinds of things. And that is the transformation that we continue to go through today as an organization, and we have much to learn, and I'm really excited about opportunities for new partnerships coming out of this conversation today. So one example of how we've really been approaching this at a national level is in 2019, as things were heating up for the 2020 elections. We joined a coalition of labor, justice, interfaith groups, and other environmental entities to create what was called the Equitable and Just National Climate Platform. And this platform really laid out an agenda for those folks that were running for election, primarily at the presidential level, to make sure that we had a healthy climate and air quality for all, that everyone has access to reliable, affordable, and sustainable electricity, water, clean air, that we're creating an inclusive, just, and pollution-free energy economy with high-quality jobs for everyone. And that the result of that is safe and healthy communities and an infrastructure that helps us move to a clean energy future for all, as well as create greater justice and equity in communities across the nation. So there are several hundred groups that have signed on to this platform. This platform was very integral, we believe, in shaping the Biden administration's commitment to addressing climate in a way that also advances social equity and justice. And we invite those folks after this call today to check the website and see if you're interested in joining this platform as well. So why do we care about buildings? Well, certainly from a climate perspective, if you look at the white line on this chart, the Sierra Club, along with many partners, including EDF, NRDC, and other large environmental organizations, have worked very hard over the last decade to reduce the amount of fossil fuel consumption from power plants. So the Sierra Club in particular focused on dirty coal plants, and to this day, over 300 coal plants have been permanently retired, which is about 65% of the total amount of power that's generated by in electric plants. And the goal is to leapfrog gas plants and go straight to clean solar and wind powered electricity. So as you can see, as of 2020, we've seen those reductions down by about 60%. Yet at the same time, across that decade and a half, the amount of carbon that's being reduced as it relates to buildings, and as you recall, buildings account for about 40% of carbon emissions domestically, that's been fairly flat, and we haven't made a whole lot of progress at reducing the amount of carbon emissions coming out of buildings here in our country. So from a climate perspective, strategically, the Sierra Club really saw buildings as a critical element of addressing the climate crisis by going after solutions such as electrification, as Amanda mentioned, to really reduce the amount of carbon that's coming out of buildings. But in addition to the carbon impact from inefficient and dirty buildings, is also the reality that it costs a lot more to heat your buildings and homes with fossil fuels, to run your appliances with fossil fuels. And we, over the last few years, have been partnering with a number of organizations, both locally and nationally, to really dig into the issue of the energy burden. Energy burden is essentially the amount of a household's income that goes towards paying for energy, for electricity, for gas and heating. And no surprise probably to many of you, the energy burden is greatest for those families and homes that have the least amount of income. And the reality is that as that energy burden it continues to be very high, it creates greater and greater injustice, as well as make it much more difficult for us to solve the climate crisis. So a local example of this growing partnership is recently, in the last few months, the Sierra Club chapter in Wisconsin joined with a number of worker right, immigrant, and housing groups in Milwaukee to release a report which is provided to you as a resource that really looks at the makeup of the energy burden in Milwaukee. One key finding of that study is represented on this graph. And so if you look at the bar chart on the left, that represents the racial demographics of Milwaukee. And generally, you'll see Milwaukee's about 2/3 white, 16% Black, 11% Hispanic Latino, and about 4 or 5% Asian. Yet, if you look at those, the demographics of folks who have greater than a 6% of their income going towards energy, a larger energy burden, you'll see that it drastically changes the racial makeup on the bar chart on the right. So close to 2/3 of the population that has a higher energy burden is African American, Black. Only 9% are white, and 21% are Hispanic. So this clearly shows that due to a number of structural challenges, rate disparities in energy, and also highly inefficient homes and buildings, older homes and buildings, people of color and lower income communities are carrying a larger proportion of the energy burden than the rest of the population. So what can we do about that? As Amanda mentioned, one thing that we are really focusing in on is building electrification. So as we are working to create power plants that are clean, running on solar and wind versus fossil fuels like coal or gas, we also want to dig in and make sure that buildings are in themselves becoming cleaner and less dependent on fossil fuels. Right now, about 70 million US buildings burn fossil fuels, for instance, oil heating or natural gas heating, which represents about 1 gigaton annually of emissions from burning those fossil fuels, as well as the associated methane leakage for gas. And our studies show that about 13% of US greenhouse gas total comes from appliances and heating within homes. And that means that we have a target that we have to eliminate 50% of those fossil fuels in buildings in this decade by 2030 to keep within that 1.5 centigrade target that many of us know we need to shoot for to avoid a global climate crisis. But in addition to the climate benefits from reducing fossil fuel run appliances in many homes, many of you know as well that appliances actually emit twice as much nitrogen oxide in tons per year as, say, gas power plants right now, which for us was stunning and reinforces the need to move to electrify appliances and heating units in homes across the country. So the Sierra Club has partnered with Rocky Mountain Institute to do this research and also provide policy recommendations to decision makers at the local, state, and federal levels. These appliances, in addition to nitrogen oxide, also are disproportionately responsible for particulate matter, which in particular is affecting people of color disproportionately as well. So this graphic just shows, particularly from gas heating and gas ranges, Asians experience a much greater than average impact from these particulate matter elements, as well as African Americans and Latinos. So some of the policy solutions that we are recommending at all different levels of government are: one, the reality is that about 550,000 new homes are connected to gas every year. Those are new homes or homes that are retrofitted to connect to the gas lines in their communities. What we are proposing is that really looking at building codes, ending subsidies for gas line extension, and really at the utility level and at the community level, being much more forward thinking about planning for gas alternatives. Secondly, gas gets a lot of subsidies at the state and federal levels to the tune of over $1.5 billion. We propose that those subsidies get wound down and move much more into subsidizing and jumpstarting electrification programs in a number of communities, including new rebates and incentives for heat pump, induction, panels, solar panel upgrades, those kinds of things, and also really incentivizing rate reform as well within the utilities. And third, just really thinking about the fact that 56 million homes are affected by this, of which 1/12 are in low income. The 56 million homes are low income households, and 1/12 of those need major repairs immediately. So really investing in low income pilot programs, protections for preventing displacement. Some of that was in the last couple of stimulus bills, protections from great rent increases, and helping folks pay their energy bills, as well as lowering those energy bills through clean energy alternatives. I also want to highlight that on the Sierra Club Foundation board, we have a number of board members who care deeply about this and are leading experts. One person I want to highlight is Danelle Baird. Danelle founded an organization called Block Power in Brooklyn. And Block Power really saw an opportunity when they saw older, inefficient buildings in low-income communities. They didn't just see a problem, they saw an opportunity, a business opportunity, and an opportunity for those residents and landlords to save money and also contribute to solving the climate crisis. So Block Power comes in, does a energy audit, provides recommendations on how to improve or reduce your carbon footprint, as well as create partnerships through cooperatives and other providers to move, for instance, a number of buildings in Brooklyn run on old oil heaters, moving those to solar power, solar panels in cooperative fashions. So that's just a quick overview of how we think about this space in affordable and healthy housing and why it's so important to the Sierra Club. We believe it's a critical tool to address the climate crisis, as well as the Sierra Club has transformed to really center justice and equity at the core of all of its work. This slide just gives you a little more information on some of the staff within the Sierra Club that are thinking about this and working on this day in and day out. Elizabeth Ward is a chapter director in the Wisconsin chapter. Sharonda is a staff person who is with the Sierra Club's Healthy Communities campaign and is really our lead on the energy burden work. And then Rachel Golden is part of the Beyond Coal campaign with a particular focus on the building electrification policies and outcomes. So just want to thank everybody for this opportunity. I really look forward to the Q&A session and hopefully some new partnerships coming out of this webinar today. Back
Thank
to you,
you,
Michael.
Dan. Oh, thank you, Dan. That was a fantastic presentation. And again, it's beginning to show everybody how the partnerships really can make a big impact on healthy homes. Before we go to the next speaker, I want to remind everybody that we are recording this webinar. If you have people in your organization that want to view it later, it will be posted on HUD.gov/healthy homes. And also, if you have questions for any of the presenters or all of the presenters, there's a question window that you can drop down in your control panel, type in the question, and then we'll read those questions to the presenters. So our next presenter, let me switch over to her real quick. And Surili, make sure you accept the pop-up. Surili Patel, Vice President at the Metropolitan Group, is a trusted voice in public health who champions diversity and works to advance health equity and environmental justice. With a profound public health and biomedical research background, she has led the climate and health discussion out of environmental circles and into the broader public health realm. Prior to the Metropolitan Group, Surili held a visionary leadership position as the architect and director of APHA Center for Climate, Health, and Equity, where she inspired action to address health at the nexus of climate and equity. Surili holds a Master's of Science in Biomedical Science Policy and Advocacy from Georgetown University. So Surili, you will need to, oh, there you go. You're all ready to go.
Thank you so much. And thank you for the invitation to be here today. Like Michael said, I'm Surili Sutaria Patel from the Metropolitan Group. We are a full-service strategy and creative agency that works exclusively with public agencies, nonprofits, foundations, and socially responsible businesses to build a just and sustainable world. And while we're a certified B Corp organization, meeting the highest standards of social and environmental responsibility, like you, we're committed to social change as a driver for everything that we do. And we do this through 3 practice areas: strategic communications, intercultural engagement, and organizational strategy and innovation. I have to say that the presentations that both Amanda and Dan just gave illuminate the need for an environmental perspective and a public health perspective on housing, because I feel like they're 2 sides of the same coin. And I'm looking forward to talking a bit more about environmental health and how it plays a role in shaping healthy homes. As I see it, there are 4 interrelated environments that, when come together, embody a healthy community for all. The natural, built, social, and cultural spiritual environments. And to that end, environmental health, as a definition, is a branch of public health that focuses on the relationships between people and their environment. They promotes human health and well-being and fosters healthy and safe communities. And environmental health, I would say, is a key part of any comprehensive public health system. The field works to advance policies and programs to reduce chemical and or other environmental exposures in air, water, soil, food, in order to protect people and provide communities with healthier environments. And I love the saying, environmental health is a science and practice of preventing human injury and illness, promoting well-being by 2 things. First, identifying and evaluating environmental sources and hazardous agents. And second, limiting exposures to hazardous physical, chemical, and biological agents, again, in air, water, soil, food, and other media that may adversely affect human health. So in essence, it is an effective and by nature proactive system that protects communities to help everyone attain good health. And the services environmental health provides are far more affordable than the absence of action. A dollar goes a long way in environmental health. For instance, deteriorating lead paint is a common source of lead exposure that can cause biological and neurological damage. So for every $1 invested in lead paint hazard control, a household could potentially save anywhere between $12 and $155. And asthma, the 3rd leading cause for hospitalization in children, on average, each case of asthma costs anywhere between $3,800 and $4,000. However, for every $1 spent on national and state level programs in the schools, at homes, etc., could save anywhere around $71 in asthma-related expenditures. And it's not just environmental health, it's about health equity, which is achieved when every person has the opportunity to attain their health potential, and that no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. The environments in which we are born, live, learn, work, play, worship, age, impact our health in various ways. Yet there are key social determinants of health that have a profound impact on people's health, well-being, and quality of life. So why can't we, go to the doctor's office or get a prescription to solve all of our health problems? According to a 2019 health equity report for the District of Columbia, 20% of what it takes to attain good health comes from healthcare or medical care. The other 80% that impacts one's ability to achieve good health is through other social and structural determinants like education, job opportunities, income/wages, access to nutritious foods and physical activity opportunities, having access to clean air and clean water. Language and literacy skills are also a determinant, and racism, discrimination, and violence. Of course, last but not least, safe housing, transportation, and neighborhoods. The home environment, in turn, may promote or diminish one's health. And of course, this audience is very familiar with past discriminatory housing practices that have contributed to economic inequality for Black Americans now, today, in the present. Housing discrimination from the 1940s through the 1960s have prevented Black Americans from owning homes and subsequently building intergenerational wealth. And racism has historic and ongoing impacts to where people live. For decades, there have been divestments in Black and Brown communities across the country. And when white families moved out of the cities, as Black families moved in next door, they also left with their wealth and their power to build better and maintain infrastructure like parks, green spaces, housing, schools, just to name a few. Similarly, not allowing Black and brown families to live in predominantly white neighborhoods left them with less housing options. The disproportionate presence of landfills and factories in Black neighborhoods is directly linked to health outcomes of those who live in neighborhoods adjacent to these environmental hazards. And of course, never before have we seen co-occurring crises wound the country and the world while simultaneously unearthing deeply rooted social and racial injustices. The short and long-term health implications of climate change, COVID-19, and the movement for social and racial justice beg the need for action to address all aspects of harm. And not acting on these basic threats to human health in a unified and holistic way is not an option for us anymore. In terms of climate change, we know it exacerbates health inequities. The political, economic, social, and environmental resources that enable people to cope with climate threats must be present. But the difficulty in accessing these can contribute to a potentially unmanageable energy burden as well as climate worsens. U.S. communities that lack accessible, affordable household energy services often have poorer health, fewer educational opportunities, limited political representation, fewer economic opportunities, and inadequate access to healthcare. In 2015, 31% of U.S. households reported hardship in paying energy bills or maintaining adequate heating and cooling in their homes, which also adversely affect their health. So as a reminder, climate change describes the change in average conditions, such as temperature and rainfall, in a region over a long period of time. NASA scientists have found that Earth's surfaces are warming, and many of the warmest years on record have happened in the past 20 years. The climate has been changing long before humans came into the picture, but now, due to human activity, have sped up. And some of these weather-related changes, including increasing flooding and droughts, wildfires, intense storms, heat waves, rising sea levels, and so much more, these conditions have far-reaching environmental, social, agricultural, and economic effects and are harmful to our health and well-being. And just to put it in a cause and effect frame, the cause and effect of climate change is more profound than the physical damage we see on the news. The climate driver is a specific climate event that leads to an environmental condition. For example, rising temperatures. And the environmental condition is what rises when in response to a specific climate change. So with those rising temperatures, there are longer heat days causing longer pollen season because of an extended spring, for example. And an environmental hazard is what will directly lead to a negative health effect, like more pollen, which then leads to the health effect itself, which is allergies or other respiratory illnesses like asthma or COPD. And of course, the exposure pathway is the environmental condition and hazard that will dictate the specific health impacts felt by a population or an individual. So in terms of climate change, we see that climate poses unacceptably high and potentially catastrophic risk to human health. Climate change extends warm seasons and worsens wildfire season, as Amanda mentioned. Wildfire is a unique peril because of the level of damage is often binary. A home is either left untouched by a fire or sometimes total loss. And the patchwork of devastation occurs as fires pass by some properties is indiscriminate. So unlike flooding and hail, just to drive home the point, a wildfire can and often does result in 100% loss of structure, loss of home. And the wildfire smoke outside of the physical infrastructure damages can cause respiratory or cardiovascular episodes, eye irritation, coughing, and so much more. And it's much more widespread beyond the burn site. When we're talking about bugs, insects, rodents that carry viruses, respond quickly to the changes in temperature and moisture, which then can increase their growth and duration. Standing water around the home after a severe storm can lead to a breeding ground for insects and mosquitoes. Lyme disease, hantavirus, dengue fever, Zika virus are just a few of the climate-related vector-borne diseases that pose a heavy health burden on humans. And of course, we're seeing an increase in the number and severity of storms. Extreme weather can impact housing structure, lead to flooding or other damages. And these increases lead to risk of water-related injuries of people, but also gastrointestinal illnesses, especially in those who are younger and have developing immune systems. And then, of course, the secondary and tertiary impacts of extreme weather can result in mold in the home over a period of time, which also have grave health consequences. So the top three are just incredible and very obvious ways our homes are impacted by climate change, which then in turn leads to those health effects. Extreme heat and energy equity are also two that I'll go into in a little bit more detail. So we know poor housing, poor quality housing, and blighted neighborhoods diminish property values and increase crime and can erode cohesive and political power of communities. And as a result, many people of color in low wealth communities in urban areas lack the infrastructure investment for things like green spaces that are critical to cooling urban heat islands. These neighborhoods get much hotter on average than other areas, negatively impacting the health of their residents and increasing energy use. Residents who rent their property often lack long-term investments incentives to invest in costly air conditioning units for short-term residents. And with the exception of Dallas and Phoenix, there is no law requiring landlords to provide air conditioning the way they must provide heat. And so this places the renter at higher health risk. And through ongoing racial discrimination and worsening climate, communities of color are facing increasingly impossible trade-offs when it comes to managing the cost of their undue energy burden, like Dan described for us, and other household needs. Low-income households or family units are also at risk because they are more likely to live in neighborhoods that have fewer trees and green spaces, which lower temperatures in the summer. In urban setting, the heat island effect drastically heats the city center and disproportionately leaves low wealth in communities of colors hotter in the summer months. And this phenomenon occurs in cities where natural landscape has been replaced by pavement or buildings or other surfaces that absorb and retain heat. And as a result, the materials create a hotter environment in rural areas. And the temperatures can range from 1 to 3 degrees hotter during the day, which doesn't seem much, but will add up over the course of many days. And even at night, the temperature difference is 3 to 7 degrees at night. The heat island effect leads to an increase in energy costs, like I mentioned, but also air pollution and heat-related illnesses. And in the same way, climate disproportionately affects certain populations. Energy is a health equity issue, I would argue. There are technological advancements that are integral components of this issue. Alternative energy, such as solar or wind, are becoming competitive at similar or even lower prices than fossil fuels like coal or natural gas. However, over 60 years, the environmental justice movement has raised awareness that people of color in low wealth communities often bear the brunt of brown environmental issues. Meanwhile, white and more affluent communities enjoy green environmental benefits. And this includes a family's ability to access and afford household energy burden. The inability to afford basic energy needs can not only impact health, but also the other areas, the other social determinants of health, like education, income, and so on. So energy, just like access to clean air and safe water, is a social determinant and therefore should be a public health issue. Communities are experiencing difficulty in accessing resources that enable them to cope with climate threats, such as extreme heat and natural disasters. And this can potentially worsen health outcomes for climate-sensitive communities and individuals. We've also learned that too many communities lack access to affordable housing, household energy services, also negatively linked to social and structural determinants. But here are some ways we can reimagine energy equity. because we absolutely need to in our changing landscape. The risks and benefits of energy production and consumption should be more equitably distributed across place, people, and time. The affordability of energy should be available continuously and resilient to climate threats. And that power is distributed and controlled or owned by the community itself. And profits are reinvested locally with sustainability and equity in mind. Existing infrastructure should be used for renewable power, eliminating the dirtiest energy first. And communities that experience health benefits of improved environmental health conditions, also relevant sectors like building, agriculture, healthcare, and community anchor institutions should be engaged in a just transition. Everyone, unfortunately, will experience the effects of climate change. The difference is that some communities will be able to recover and recoup, while others won't. So it's not enough to rebuild. We need to build community-level resiliency that builds communities to withstand increasing frequency and severity of climate events. And to do this, we need to build partnerships. So starting with strengthening community partnerships. By that, I mean building partnerships with underrepresented frontline tribes and communities that are protecting land, maybe that various energy interests see as available. And also supporting advancement of energy efficiency and affordable alternative forms of energy in historically marginalized communities, including low wealth communities and communities of color. And of course, partnering with social service or community action agencies and serving as a voice of connection to local or county government. I think healthy homes and groups that are working to improve the health conditions within a home can also work with scientists and public health community to support research and benchmarking that quantify the health impacts and cost of energy and justice to support a culture change that prioritizes a just economy and human well-being, while also promoting energy efficiency in the home and public operations through community and agency engagement. This is also a great audience to lend a voice and to offer partnership in advocating for policy change that has healthy housing at the center so that it's not a choice for the haves versus have-nots. Lobbying for fuel efficiency standards like electrification and promoting independence from fossil fuel resources is key, and including definitive statements on equity in energy, housing, and climate programs and policy can really drive change that's sustainable. And of course, developing education and communication resources and templates for others to use in their testimony or op-eds can help more voices participate. And of course, using national conferences, platforms, webinars, and other means to inspire and educate action on housing and climate change is really key to bringing on more partners. And then, of course, we can reimagine the role of housing at the climate and environmental health table by encouraging partners and partnering agencies like FEMA to prioritize housing and community rebuilding in their mission and budgets that's different than status quo. There are lots of other coalitions out there that work on healthy housing issues that can help coordinate a variety of level of efforts from local to national. For example, Metropolitan Group is also partnering with the Green and Healthy Homes Initiative to work on variety of healthy home activities. And as many EJ communities say, if you aren't at the table, you're probably on the menu. So let's get a seat at these tables. Our ability to reimagine a healthy and just future is rooted in our courage to take a step towards equitable and sustainable change. A just transition is often inappropriately imagined solely as an economist's or an environmentalist's task to bear, when in reality, climate and energy and housing, those intersections are really a health equity issue, which means we're all affected and that we should all stand up and take action. This movement requires a wide range of actors to reimagine a sustainable transformation of sectors, including housing, energy, agriculture, business, health, so many more, all the while addressing the historical and structural inequities and ongoing injustices. The goal of working towards justice is to seek fair outcomes. So it's not enough to offer ladders or even a taller one. We need to fix the system to offer equitable access to both the tools and the opportunities. When we think of housing as a health issue, we can think of solutions and partners that challenge the presence of the problem and find new ways forward together. I thank you very much for the opportunity to speak with you today, and I look forward to the Q&A. Thank you.
Thanks, Sarili. So our next presenter I will introduce in a second, but he does not have slides. He's going to have a webcam that he's going to talk to us. So I'm going to make him the presenter. And Tom, if you will, let me see if I can see, go ahead and accept the presentation. There should be a pop-up window that came up.
There you go.
Fantastic. Okay, so we can see your screen now with the FY 2020 food safety, and you have your webcam on, so we should be able to see your webcam. There you go. So we can see your desktop.
Yeah, we don't need to see any of that.
Okay, so we can see you now. This should be broadcasting. Let me give you the introduction, though. I also want to remind people that we do have a questions window that you can drop down and ask questions, and then we will read those questions to the presenters at the end of Tom's presentation. I also want to point out that there is also a tab called handouts, and one of the handouts in that is a short, brief bio sketch of each of our presenters and contact information that you can use if you have questions after the webinar, or you would just want to contact them for partnerships. So our next presenter is Tom Neltner, and he is the Environmental Defense Fund's Chemicals Policy Director, where he leads efforts to remove or minimize hazardous chemicals from products and the marketplace through cost-cutting policy initiatives. He is a chemical engineer, certified hazardous materials manager, and an attorney with experience in chemical safety issues in the home and workplace, environment, and in food and consumer products. Tom has worked in lead poisoning prevention for over 20 years and played a leading role in an EPA-convened multi-stakeholder work group that made recommendations to the agency to upgrade its lead in drinking water regulations. So Tom, you have the floor.
Thanks, Michael. And you guys can hear me, right?
Yes, they can hear you.
All right. So you just heard 3 great presentations. I'm not sure I can live up to that. They've given really thoughtful perspectives of the bridges and the opportunities between environmental health and environmental organizations. I opted not to go to a PowerPoint simply because I figured after an hour you needed a break, but also because I wanted to make it a little more dynamic and share some of my perspectives and get sort of right at that question that Amanda asked, because I don't have the answer. I will give you some of my perspective. So I've been a volunteer, was a volunteer for the Sierra Club for 7-8 years, from 2004 to 2010, as the co-chair of the National Toxics Committee, which was an early effort by Sierra Club to really get into how we dealt with toxics. And we focused a lot on lead because lead poisoning prevention is a passion of mine. And so after that, I went to NCHH. So I spent time deep in with healthy housing. So I've walked in those footsteps that Amanda is in. I've been at NCHH. Actually, I've been there twice as over the years. Then I moved into food and tried to look at bridging the gaps between environment and food issues. And my focus has always been on chemicals. Spent a year at the Natural Resources Defense Council, and I was in the environmental health program, which as an organization that was about 500 or 600 people was about 40 people. So it was by far the smallest of the programs that were working on it. And that's pretty typical. So I come at it from that. I never understood all of NRDC. At EDF, I've been here about 6 years today, actually. And the environmental health program is also the smallest. We actually started on chemicals. There were only 11 or 12 in an organization that's now about 700. We've added air pollution. I think we're about 40 people now, 40 or 50 people. But that's a big expansion. The chemical side is probably 15. The air pollution side is probably 35. So I can't begin to speak for EDF. I can't begin to answer all the questions that's been raised. I admire Dan and the work that Sierra Club has done, and I think Cerulli provides a great aspiration. I'm going to get at Amanda's question about why, and I see somebody just sent me a note to stop sharing the screen to get rid of my desktop. Yes, we need to get rid of that desktop. That was me climbing a 14,000-foot mountain. I'm proud of that, but not so proud that I need to share it like this. Okay.
Tom, I have the front slide up now, so that's an old message, but yeah, we're looking at the front slide. So.
All right. Yeah, it was a fun trip up the mountain, but not relevant here. I come at this issue passionately about healthy housing. I started working on chemicals. I cared deeply about chemicals, went in to work with occupational. Then I realized children were not being protected. And if you're going to protect children, it's housing. It's got to be housing. And so that's where I got into housing issues. And now I work on food and water primarily, those primary issues, but still passionate about lead. EDF doesn't spend a lot of time on healthy housing. We don't spend a lot of time on housing in general. Sierra Club, Dan, your description was a good example of how you focused on the built housing. So what happens in what people call the big greens, and I think EDF is in one of those, is that we all sort of focus on our expertise and our narrow areas where we can make an impact, because that's what it's all about. You want to be able to have an impact. You can't do everything and still have an impact. So in EDF, one of our niche things is we work with big businesses to try to move them forward. We work with Walmart. We have a whole team in Bentonville working with Walmart to challenge them to do better on global health, to get toxics out of consumer products. And that has been how we've gone at a big part of our work. We have a whole group, EDF plus Biz, that works with Amazon, it works with Google, it works with Walmart, it works with FedEx. And it's about changing those business practices, especially when government agencies are slow to react. That in some ways it moves the whole needle forward. You know, Walmart is talking about gigatons of carbon dioxide removed and changing the discussion. When we talked about chemicals, it said we wanted to get rid of 8 chemicals from our household and personal care products. And it got it out faster than we could ever imagine have happened if EPA had acted or FDA had acted. So part of our angle is businesses, which doesn't naturally lend itself to housing. Also on climate, while we are big advocates to preventing climate change, and Sierra Club is another leader on that issue. Our angle has often been focused on methane. Methane is a greenhouse gas. It's one that has more damage quickly, but doesn't have the long-lasting effects of carbon dioxide. And so we focused on that because we saw tremendous opportunities. That half of the methane that comes out of the ground never makes it to the gas stove that Dan and Amanda showed. So we want to make sure that we stop wasting it, that we stop leaking it into the environment, that we are smarter about oil and gas extraction and saving the methane that we have and not wasting it. And then being smarter about how we burn it and use it. And of course, moving to the non-gas alternatives, big into the green energy sources. But because of that focus on methane, it didn't lead us well to housing because it was focused on the distribution system, the losses in getting it from the well to the house. So therefore, we have not had a big emphasis on housing. We talk about housing. Amanda and I talk often, not just because we're friends, but because I worked at NCHH twice, but because I get how housing is there. And I think EDF is moving in that direction as it expands its language, but we still have to focus on our expertise and the things we can really drive. I think, Cirilli, you did a really nice job of highlighting, and I've got your slide up, the path to justice, of really thinking about environmental justice, because what I've found is if you're going to deal with environmental justice or just equity and justice, period, you have to deal with housing. And that, I think, is where, I mean, in some of the ways, my experience, Dan, with Sierra Club and the National Toxics Committees, I saw that transition as it got more into the environmental justice and therefore got more into the housing. EDF doesn't have the grassroots network that that Sierra Club has, that whole network of state and local chapters and groups. So what I think is the environmental justice movement is pushing EDF to asking some of these more fundamental questions, because you can't talk about environmental justice if you're not also talking about environmental health. And it's really strengthened the health program's role in EDF because of the environmental justice angle. I actually approach it straight up civil rights, because we've got to be thinking about offsetting that long-term systemic racism that we see. And fundamentally, that racism starts with housing. It starts with the redlining. It starts with the segregation. You know, we can, one of the people I admire, Bill Crawford, back in Indiana, where I'm from, he was a longtime civil rights advocate. He talked about Brown versus Board of Education, said we need to desegregate schools, but we also need to desegregate housing. We never quite got to the housing side, and maybe we're getting to it now. So I don't have the answers. I'd love to see a discussion. I'm going to turn it over to that discussion in a minute or so, but I wanted to highlight that you have to think of each of the groups as different. NRDC, Sierra Club, Earth Justice, Nature Conservancy all have entirely different angles. They work together. One of the groups that brings them together is the Blue-Green Alliance, working with labor. And I think there's opportunities to do that in housing. And I think we need to frame that around the justice angle, not just environmental justice, but justice straight up. And I think that's something that we're all wrestling with as organizations. And then once you bridge that gap with individual organizations, then we can talk about how to work it among the others. Even though they're big greens, they're all very different groups. So let me open it up for questions and see where we want to go from here.
Thanks, Tom. I want to remind everybody that if you want to ask a question of the presenters, that you can use the questions drop-down window. We already have a few questions that have come in, but we welcome your questions. And I also want to remind the presenters that when you're talking, do check your mic to make sure your mic's on, to make sure that you can answer the question. I also want to remind people that if for some reason after today you have a question for one of the presenters, we do have a handout in the handouts tab where you can drop down and you can download it's the small speaker bio sketches and also contact information for how to follow up with them. Right now, what I'd like to do before questions is one of the requests that came up, I'm going to switch it over to my screen here, there's a couple of websites that Amanda was talking about, and I want to bring those up real quick so that people can write those down. One is the Lead Service Line Collaborative, and the other is the National Environmental Health Partnership. And you can see those on the screen right now, hopefully. And I'll give it a little bit more time. So we're going to have questions asked of the presenters. So I believe, Joe, your mic is muted. If you want to go ahead and ask those, or if you'd like me to ask those.
Sure, I'll be happy to do that. We have our first question is, what is being done to provide for research into special housing needs for people disabled by chemical exposures? And this is from Elizabeth.
For the presenters, make sure your mic's unmuted if you're going to answer that question.
I can tell you, I don't know. Chemical sensitivities is a complicated, difficult issue. When I was at the National Center for Healthy Housing, we weren't as active on it. Maybe Amanda has more to share on it. This is Tom. And so think that's an aspect. It's one of the most poorly understood areas of chemical exposures is those people with the sensitivities to it. And I know it's life-changing, and I have friends who've suffered through it. It's so poorly understood, but clearly needs more research.
Thank you, Tom.
Amanda, do you have any thoughts? Or
I don't have any things specific, but I think it's a great opportunity to highlight the importance of these kinds of discussions and to note gaps like that. And I will note also that the organizers of today's webinar, our colleagues at HUD, are control, I think, and oversee one of the biggest opportunities for healthy housing research dollars out there through their Healthy Homes Technical Studies grant program. And I, not to sound like an infomercial for HUD, but that opportunity is open right now. And so that's an opportunity that comes up once a year to propose new areas of research to help fill in those gaps in our understanding, and also both what the problems are, but also the solutions available to be able to tackle issues like that. So just a plug for that open opportunity right now to partner and put together a proposal to advance our understanding.
Thank you, Amanda. That was wonderful and great timing since those grants just recently came out. We have another question about lead in shooting ranges and hunting, especially in the U.S. Forest Service lands. So there is hunting and shooting in the U.S. Forest Service lands that affect drinking water and the surrounding communities. Yet EPA doesn't have the authority to regulate lead in forests. Is there anything that can be done about this, or does anybody have any information about how we can stop this ongoing and increasing source of lead pollution?
well, I guess that's probably me because I'm the generalist on that one. I've focused on lead
Thanks,
for a
Tom.
long time. Yeah, EPA doesn't because alcohol, tobacco, and firearms, as well as food, drugs, cosmetics, and pesticides are explicitly out of the scope of the government's law that deals with chemicals broadly. That's called the Toxic Substances Control Act. So it's explicitly exempted. There are groups that are working on it, but it's, from a federal agency standpoint, it's pretty much the Department of Interior. EPA can get involved to the extent that it contaminates public property, which is where its scope is, or it's air pollution contamination. But the whole area of guns is obviously pretty controversial and touchy. So groups, I think it's more driven from the local side up when there are specific challenges. EPA has very limited authority to act, but other federal agencies that are responsible for public lands have a greater role. And then there's always CDC. CDC has an ability to have a bully pulpit and get the word out.
Great, thank you, Tom.
And this is Amanda. I'll just add also, and I'll see if I can drop a link into the follow-up materials for this webinar, that we, as part of an initiative where we partnered with the Centers for Disease Control and Prevention, the Association for State and Territorial Health Officials, and other organizations, we supported a number of grantees around the country using a health and all policies framework to advance lead poisoning prevention efforts. And one of those recent grantees was the state of Idaho and their health department there, and they have been doing a lot of work to try and create new partnerships with conservation organizations and also hunters and folks who like to use those lands recreationally around this issue and of lead and contamination. And they've started to develop resources and materials, but also have some lessons learned about building those partnerships. I'm happy to share those materials. And if whoever asked that question, if you want to send me an email and follow up directly, I'll make sure you get those.
Thank you. That question was from Elizabeth. And she also had another question, Elizabeth did. She asks, the Hide No Harm Act is essential in providing information about toxic exposures and protecting workers from retaliation. Is there anything being done to help pass this law? And we all know that we've seen children with that have been lead poisoned from take-home lead and other exposures. So oftentimes folks are bringing those things home into the house. So there's a correlation between healthy housing and some of this protection for the workers. if anybody has, I think, Tom, that's probably you again with the Hide No Harm Act question.
I've never heard of it before. I'm doing I just did a Google search to find it. It looks like it was introduced in by Senator Blumenthal in 2015. I don't know anything about it.
Terrific.
Yeah, we were very focused on getting the Toxic Substances Control Act through, because introducing a bill is one thing that starts a message, but getting them passed is the bigger challenge, especially in this polarized environment in Congress.
Thank you. So Elizabeth, we don't have an answer for you, but go ahead.
Oh, Joe, I was just going to say that earlier in the presentation, Amanda was talking about the organization aisles, and you probably saw that they actually posted. I can read that, or you can read that, so that people know. Okay, so Amanda was talking about the organization aisles and how wonderful they are to work with, and they've actually posted this for everybody. My organization aisles is part of a nonpartisan collaboration led by the New Jersey League of Conservation Voters Education Fund to create an environmental policy guide that will be presented to the candidates this summer, November 2021 election. It is designed to lift up the organizational contributors and their priority issues, not only with candidates, but also with the participating organizations. Aisles pieces led and healthy housing, next steps, better serve the energy efficiency needs of low-income households, and New Jersey Whole House program. We participated in the last governor's recommendation books 4 years ago. They also are a member of the Building Electrification advocacy group that is seeking to change regulations that currently discourage building electrification in New Jersey. As practitioners who provide lead-safe and energy efficiency home improvement services, we are able to offer firsthand experiences about the challenges in electrifying housing in low-income communities. The committee includes representatives from RMI, Acadia Center, the Nature Conservancy, NRDC, Northeast Energy Efficiency Partnerships, and Energy Efficiency Alliance of New Jersey. So again, that was the organization that Amanda was talking about in her first speech. I want to remind everybody.
I can go ahead and follow up on that. You know, like Amanda and the National Center for Healthy Housing, Aisles, who have worked with for years, is a wonderful organization of building bridges across New Jersey. Like NCHH, they're a really good example of reaching across to different organizations and building those bridges. And that's ultimately what it's about. Amanda pointed out the lead service line replacement collaborative, which I helped form and then drafted Amanda in. And then Amanda pointed out the National Environmental Health Partnership Council, in which she drafted me in. So I've been serving on that. It's that kind of bridge building that's important.
Thank you, Tom, for that follow-up. So we do have a question. We actually have a couple questions coming in, Joe, if you want to unmute your mic and go ahead and ask those questions.
Sure. We have a couple of hands raised too, and we can decide how we want to do that as well.
So the people who have their hands raised, you'll have to type your question into the questions window. We cannot unmute mics for attendees at this time.
All right, so we have a question. Can you quickly address how we need to adjust advocacy strategies for public housing versus private rental housing versus low-income homeowners? And this is from Rachel.
Hey, Rachel. So this is Amanda, and that's a great question that probably bears its own 90-minute webinar in and of itself. But I think you're right to point out that there can be some common levers that we're addressing at the local, state, and federal levels, as well as some different opportunities to pursue advocacy efforts to impact different types of housing. And without going into too many details here, I'd welcome an ongoing conversation. I would just say that we need to be pursuing all of those opportunities, that many of the communities that are bearing the burden of some of these environmental crises and the way they intersect with housing have a mix of all of those different types of housing. So we really need to be pursuing a portfolio of strategies as we move forward.
Thank you, Amanda. We have another question from Jill Samuels. There does seem to be a gap in the resources for adults that have occupational lead exposure and poisoning. Are there any partnerships working on this issue?
you've always talked about healthy housing needs to be for more than just children, but just focusing on the lead side, I completely agree. We've been so focused on children who are critically important to our future. I care deeply about them, but lead is quite clearly connected with cardiovascular disease and death. Death is a pretty serious endpoint, as I learned in the environmental health world. And, lead is one of those ones that gets you throughout your life, but we need to be thinking about it not just when you come into the world, but trying to stop you from going out too early. So lead is one that we need to do more on the adult side. And I also think that if we could focus more on renovation contractors and getting them to be careful, we could actually do more to protect people. There aren't any groups that are really talking about it. We've been raising the cardiovascular disease issue, and it doesn't get a lot of traction. So I think it's a real opportunity.
I strongly agree with that, but I also would just suggest that I think there is reason to hope that the conversation is starting to change. I say that because CDC's somewhat newly reconstituted advisory committee for lead, the LEPAC, has including adults as a part of their focus and their charge to consider impacts on adults. And I can say in my own conversations, with different groups, including offices on the Hill, when we are doing some education and advocacy, that we're increasingly being asked to say, yes, absolutely document the impacts on children, and that's where our focus is. But can you also include some information about the evidence, the growing evidence base about the impact over the lifespan and on some of these other endpoints for adults that Tom is mentioning? So, and that's just been happening, I would say, within the last 12 to 18 months. And it's just coming up more and more regularly. So I think that that's going to be a challenge that the Healthy Homes field is going to have to learn how to respond to. And again, I believe the partnerships may be a key to solving that challenge as well.
Joe, you're self-muted. Do you want to read that next question?
Sure, I actually have a question for Amanda. You made the case for why healthy housing practitioners and advocates should care about partnering with environmental organizations, but what's in it for the big environmental organizations? What can environmental health or healthy housing organizations bring to the table that benefit the environmental agenda?
Sure, I'm happy to start off this question, but I think our other panelists, you'll probably have some ideas to contribute here as well. I think from my perspective in listening to Tom and Dan and Surili speak today, this sort of surging interest from the big greens, those environmental groups, in racial and environmental justice and in talking more about the impacts on human health are naturally going to lead them to housing, right? If you're serious about addressing environmental justice issues and about looking at health endpoints and you're listening to the communities that you're partnering with, housing is almost certainly going to come up as both key part of the problem, but then also being really central to the solution. So I think that's one thing to keep in mind. And of course, as these organizations do show a greater interest in some of these endpoints, we in the healthy housing field have decades of experience and we have data, right, on health, on the solutions that are available, on the return on investment that we can bring to the table, right, so that they don't have to sort of navigate their way through that we know where to get that data, how to use it, how to interpret it, how to message around it. We also can help them make the case, right, where we have information about the potential return on investment of these types of interventions. That helps these big environmental organizations, expand their case and make the case for investing in these types of solutions that benefit both health and the environment. That makes their case even stronger. So I think that's another asset that we bring to the table. And I think another thing that I haven't heard necessarily come up as much today, but something I've heard from some of the communities we work with on the ground who have had some success in partnering with environmental organizations is that in the healthy housing field, we already have a presence in many of these communities that may be of interest to these big environmental organizations. So we have established relationships. We have experience working and partnering with these communities and listening to and responding to their needs. And that's another asset I think that we can bring to the table to help advance our common agenda. But I'd be really curious to hear from Dan or Cirili, Tom, what else you think you see here as what is it that the healthy housing field brings that would be attractive to the big greens?
Yeah, this is Dan. That was a great response, Amanda. I guess the other thing I'd say, just to reiterate what I tried to get across in the slide presentation, is that buildings themselves are a significant part of the climate problem as far as emissions, and also for human health and other pollution effects. So we believe that affordable housing also means cleaner housing, both for emissions and also for particulate matter and that kind of thing. So just from the climate perspective, buildings, as I said, are 40% of the problem as it relates to climate emissions, and to really get at the core of that, we've got to do that in a way that advances justice. But we also think those those older buildings, those most efficient buildings, are also the ones that create real energy burdens and are in these lower income communities. So I'd say just from a climate perspective, there's that. And then I'd say the second piece is really that the Sierra Club at its core is in a transformation to say, hey, let's really live the mission that we've always had, which is not just protecting wildlife and places, but creating a sustainable planet for all living beings, including humans, and really leaning in on that as the core mission, and that environmental protection has to be advanced in a way that is also advancing social and racial justice at the very core of the Sierra Club's purpose.
Okay, we have time for one more question. These are all excellent questions and fantastic panelists, and I'll give a conclusion here in a second, but let's ask one more question.
Sure. We had a question about healthy housing and mental health. And Cirili, I think this would be a great question for you. You talked about those 4 different environments, and one of them being, our spiritual and our relationships environments. Could you talk about the correlation or the intersection between mental health and healthy housing? We just got out of a mental health month, and we've been talking about that, and moving into healthy housing month seems like a great time to have this conversation. Would you like to address that?
Sure, I'd be happy to. I think the correlation is, very palpable and tangible in many ways when we're talking about what impacts our health in terms of environment. Of course, our physical environment does, but also it has broader impacts on our social and emotional health and well-being, and that encompasses, as a part of our mental health and wellness. And we're seeing a lot of things happening. I mentioned the co-occurring crises where we're having these major issues, major challenges in this point in time intersecting in a way that it seems overwhelming and all-consuming. With climate change, COVID-19, and the movement for racial justice, we're seeing these kind of conditions impact us in many ways, economically, for example. So I think about half of the American workforce has experienced mental health problems since the beginning of the pandemic. And that includes their ability to afford safe and nutritious food, pay rent or their mortgage, make good on other kind of payments like medical payments. And the mental health needs, the stress puts a burden on mental health needs, especially by Blacks, Latinx, and other global citizens that are unmet by the country's mental health system. So in terms of climate change, we're going to see an acceleration for the need of mental health services as climate worsens. For example, I think there are 3 main ways in which we see climate impact mental health: the immediate impact, the gradual impact, and something that I like to say indirectly impacts our health. So in the immediate sense, we're seeing sudden effects like natural disasters that are super destructive to our home, to our livelihood, to just even our health, right? Injury, for example. So natural disasters can cause this type of post-traumatic stress disorder, anxiety, depression, stress. And this could lead to self-harm. We're seeing instances of substance abuse on the rise and suicidal ideation occur. And then I mentioned gradual impacts, which are a little bit more slow forming. They're longer term associated with climate change and public safety. So we know infectious disease is on the rise, and our homes can contribute to that challenge. And then we know chronic illnesses are on the rise, like asthma or allergies, because of those warmer seasons and our inability to protect us against it, because we have to perhaps open a window when it's really hot outside. And of course, we're going to be, faced with pollen or even pollution downwind from power plants or other types of factories. This can lead to chronic stress. So felt over a long period of time, we know this type of chronic stress not only makes shifts an imbalance in our mental wellness, but also for younger people, we're seeing it affect academic achievement, especially in school-aged children. And then the indirect impacts come from climate change affecting the way we think about ourselves and the world and one another. So after a climate event, or maybe even displacement because a home is no longer available to live in, or you just have to flee. I know a lot of West Coast habitants have had to leave their home because of a fire advisory. It's already started fire season here. And they may experience, because of this movement, this migration, if you will, a diminished sense of self, difficulty relating to each other. And that may not seem like a big deal, but social cohesion is such a huge part of our identity and our ability to cope, that when communities are impacted this way, it could lead to household issues like domestic abuse or child abuse or violence, and the economic insecurity and physical damage to other types of infrastructure are also potential impacts on the indirect ability to achieve mental wellness. So it's all interrelated, especially because we're in these times of, COVID, where we're being extra cautious. I know over 50% of Americans have now been vaccinated, but still, we're still worried about our children and those who are immunocompromised. We're worried about where our next paycheck is coming from for many of us. We're worried about climate change and maybe it'll happen tomorrow, maybe it'll happen later, but either way, I'm stressed out about it and anxious. So all these things are really playing an integral role in our ability to achieve mental wellness, which is something that isn't something that we take for granted. And something that further challenges us is our ability to achieve mental health services. Like I said, there isn't enough Black and brown mental health specialists to go out in communities, but on top of that, just accessing them, paying out of pocket for mental health services rather than being affordable and accessible. Also, the stigma tied to achieving or accessing or receiving mental health services is also a big issue in a lot of communities across the country, regardless of race or income. So those are all things that, have a huge impact on our health, but also, oftentimes happen at home. And the identification of those mental health impacts, it's also something hard to recognize in ourselves, but also in our neighbor. And how do we strike that conversation so we can check on people, have that level of social cohesion with our neighbors to say, hey, this is something that I've noticed. Are you okay? So I'll just leave it at that. But I think that where we live has a profound impact on our mental health and well-being.
Thank you, Cirilli. On behalf of the HUD Office of Lead Hazard Control and Healthy Homes, the National Institute of Food and Agriculture at USDA, and the National Healthy Homes Partnership, I want to personally thank our presenters today for a fantastic kickoff for National Healthy Homes Month. Amanda Reddy at the National Center for Healthy Housing, Dan Chu at the Sierra Club Foundation, Tom Neltner at the Environmental Defense Fund, and Cirilli Patel at the Metropolitan Group. Thank you, and at this point, we will be ending the webinar.